I'm gonna be breaking down scenes from Grey's Anatomy. Let's do it. So it looks like we have Meredith here. She's, doing basic, it looks like she's assessing the patient, listening with her stethoscope. That's pretty normal to do. There's also usually a computer in every room. It looks like she's typing on a tablet though. Looks like she's pushing on the abdomen. Pretty normal, seeing if the guy is kind of awake. Seems kind of out of it. That we do that too. We throw our gloves like that. If we can't, then we just like work as fast as we can. Sometimes we just can't find the trash can. Well, now the patient's awake. Oh, she doesn't notice.
Let's get back on the bed.
Uh-oh. Oh my gosh. Yikes. Now this, okay. This is a little bit unrealistic. I mean, there's definitely times a patient can get combative and violent like that, but typically you're calling for help right away before you even say, get back to bed. If someone's out of bed, you're like, I need help, get them back into bed. Don't try and do it by yourself. Absolutely not. It seems pretty busy. Let's keep watching. So they're in the ER, it looks busy. I feel like no one is even kind of seeing what's going on. So there's obviously a code going on in the other room, which is crazy to think about. So basically another patient obviously is needing CPR. And then Meredith, the main actor, is in another room and the patient is just whatever. So obviously these things can sort of happen, but this just looks so busy. And typically if that was to happen, you wouldn't have the door to the room closed unless it was like a contact thing or something like that. And you would usually always call for help as soon as you can. In the room, there's usually like call buttons or code buttons that you could hit, panic buttons if you need something like that. It's surprising to me that like no one has even like seen what's kind of going on with Meredith. So then when they say call it, it means that they decided to basically, okay, we're not gonna keep pressing CPR. We're not able to bring the person back to life. So it's a very sad moment when this happens, and it's very common in the hospital though. So as they all run out of the room, that's what happens. The doctors now, they have to leave and they have to go to the next patient and see what's going on. They don't really have time to like sit there with the patient. They got to move to the next patient. It's so weird that door is still closed and no one's noticed that Meredith hasn't been there yet. But it looks really, really busy in the hospital right now. Everyone's running around. It looks crazy. Grey's Anatomy. Oh, she's on the floor. Look at this. How scary. I feel like at this point, this isn't realistic because I feel like someone would have been checking on her or found her. I don't know, maybe it is, but I've never ever experienced anything like this where people are on the ground. Oh, now it looks like someone found her.
Line is going in.
Wow.
8. What, trauma series?
Red.
Left for like 5 minutes and this happened.
He was post-ictal.
Hyperregression can occur after a seizure.
Temporary fugue state.
So they're talking about post-ictal, which means after a seizure, which this is correct. People can get confused and things like that. Obviously, they could be aggressive and whatnot, and she was kind of in the room by herself, assessing the patient, and obviously all this happened. I've never seen a case, obviously something this severe, but I have heard people, they've gotten hit by a patient and things like that. Just nothing like this severe from a patient. So in this scenario, I have never seen a case this severe in the hospital. Obviously it does happen though. There can be combative patients and nurses can get hit and they can get hurt. What's really great about my job is that I always feel like there's always an extra hand. There's always like 1 or 2 people going in the room. You usually just don't try to be by yourself because of these situations that could possibly happen. So it's always good to like kind of have a buddy and try to do that.
1, 2, 3, easy. Okay, easy. All right.
So they're putting a board underneath her back to take the x-ray. I think they mentioned that she did have rib fractures, which are very, very painful. So they're doing that. So typically they will roll the patient like that if they need to. But with new technology lately, we've been actually able just to kind of like slide the board under the patient. So it's been a lot easier. But if something like that does happen, a typical, we call it log rolling.
And this is gonna burn. I'm injecting the light.
You can't work on your family.
Everybody in this damn room is her family.
It's fine.
With a chest tube placement, typically everyone before COVID or pre-COVID would have to have a mask on, and then as well as like usually a hair bonnet because it is a sterile procedure. You can see they have a blue drape there when they're going in with the lidocaine, which is like basically used to numb the site before they go in the chest tube. But it's very common to just kind of, you know, put the chest tube in as soon as you can. You really want to open that lung up if the lung is collapsed.
Here we go.
So just like that, as they make the incision there and they're putting in the chest tube, you can see around it, they have it sterilized, which is what you would typically see something like this.
The evidence of barotrauma, possibly from the blows. I think Karev might be right. I don't think she can hear anything we're saying.
Her jaw's locked.
Let me see. Yep, easy. Yeah, we've got a dislocation here, possible fracture. Well, there's no way we're getting the tube in there.
You have to get a tube and you have to preserve her airway.
So I'm not really sure what they're talking about, something about her jaw being locked and she can't hear, but it's very scary. She seems like so awake. And sometimes that is the case for what happens because we can't give them, it just really depends on every situation. But this one is like obviously very, like it's just getting me a little choked up because I'm like, oh my God, like could you imagine like all your friends are there like trying to work like on you? It's crazy.
We're gonna have to pop your jaw open, okay? I'm sorry, I know, but we have to do it. We're gonna do this on the count of 3, you guys. Ready? 1.
And now all of them are watching her and just doing her. Wow. Oh my God. Oh, and that was the scene. Well, that was a pretty traumatic scene. I've never seen a patient do that much damage to someone. And usually I feel like there's more help coming on the way, typically for a patient to be that aggressive, but it does happen. There are patients that are crazy. Actually, like one of my first nursing students, she had to like get her whole knee replaced because patients can be combative. So the front lines can be dealing with combative patients, unfortunately. Thanks you guys so much for watching. If you guys want to see more videos like this, let me know in the comments below. And I'm Sarah signing out.